this is pretty interesting. A new CDC data rather suggests that only a tiny fraction of Americans may actually have COVID-19 antibodies, even in some of the hardest hit areas. So we want to bring in Dr. Neeta Ogden to talk a little bit more about this. So I know, Doctor, there's a lot of kind of conversation about what having antibodies even means, but I know this is one of the ways that we measure whether someone has been exposed to a virus. So, why is it important to track antibodies? And then what do you make of the study that, maybe people really, only a tiny fraction actually display antibodies?
Yeah, well, good morning. Thank you for having me. And I thought this was a fascinating study because it pointed to this glaring gap of knowledge that we have about coronavirus. Basically, the CDC did a survey. They took blood samples of people in the United States at 10 different sites in the country from March through May. And what they found, these people were not sick with coronavirus, by the way. They were going for their routine cholesterol check, or they were hospitalized for things not related to COVID. What they found, though, is that the number of people who turned up with positive antibodies to coronavirus, so the number of people who were indeed infected, was far higher than the number of cases that have been reported from these 10 sites. And that really points to the fact that a large number of infections have gone undetected. Why? Because we do know that more than 40% of people have coronavirus without symptoms. Those people probably had mild infection. They weren't that sick. They didn't seek medical care. And so they never got tested. But in this survey, their antibodies were shown to come up. They were indeed infected. And it really means that those people continue to go out in the community and circulate the virus unknowingly. And there is that huge gap in terms of what we thought the number of cases were and how many people are truly infected. I think this speaks to the fact that, number one, people don't know when they're sick or infectious with the coronavirus. We still very much need to be wearing masks, socially distancing, washing our hands. The other thing is that a large percentage of the population in the United States is vulnerable and susceptible to the coronavirus. They looked at the percentage of people who tested positive in New York, for example. One of the hardest hit states, 1 in 4 people were likely exposed. In April, the seroprevalence of those antibodies was 6.9%. In May, it was around 24%, which correlates with what we see, how extreme the virus was in that area. But that doesn't even touch the 60% that we need for herd immunity. So this idea that people think let the virus progress naturally through our community will achieve herd immunity is just not true. It's a myth, and that's really dispelling that myth when we look at these kinds of numbers. The final thing is that we really need, and it's sad we're not even close to this, testing. We need to be testing people who do not have symptoms. If we really want to effectively open up schools and businesses, there should be a regular testing of people without symptoms so that we can address the people who could potentially be spreading the virus well before it circulates into the community. And unfortunately, we're not there. Hopefully, with rapid tests in the future or antigen tests, we might achieve that level of detection.
So, Dr. Ogden, all the points that you made about the people who could be infected and not know it and unknowingly spread it, as you know, the CDC says that the number of infections in this country could be something like 10 times higher than reported in some parts of the U.S. Dr. Tom Frieden, who you know is the former chief of the agency, has accused most states of failing to report the critical information to track and control the resurgence of COVID-19. Can you explain, I know we ask you this every time you're on our air, and we ask other doctors exactly the same thing, why contact tracing is so important? What have other countries been able to do to flatten the curve and to mitigate the number of infections that we haven't been able to do on a national level?
Yeah, I saw that from the former head of the CDC, that basically because we don't have a national message and national leadership heading this, the states have basically been forced to create and develop their own metrics, and they're failing. There's incomplete data. We don't know how effective contact tracing is in many states, because states are just simply not reporting that kind of information. We don't have information even about testing turnaround time. We're hearing reports of 8 days, which makes tests worthless, essentially. So the effectiveness of contact tracing is really being seen in places like New York and New Jersey, where Connecticut, these places where, because they had very strict reopening guidelines that people followed, we've controlled this virus, and we don't have as high community transmission. Now, when cases pop up, contact tracers go into action, and they can quickly identify who somebody who has tested positive and is infectious has been in contact with, and can contact those people and have them go into quarantine for 2 weeks. And that contains community spread. And that's what we've seen effectively controlling the virus in countries like South Korea and Singapore and China, because they have that. Now, where we have such high prevalence of the virus and such high community spread in Florida and Texas, Arizona, California, contact tracing almost becomes impossible, unfortunately, and largely because all those steps that are involved with a slow reopening were simply not followed. So it's really unfortunate, actually, that this incredibly useful tool can't even be used at this moment, largely because of how quickly those states reopened.
And just sort of anecdotally, we've been talking a lot about the messaging surrounding masks, the messaging surrounding washing your hands. When it comes to contact tracing, I think we've also sort of we haven't delivered a very strong message. And anecdotally, you hear about stories where people are being contacted by contact tracers and are refusing to share information about where they have been and who they've been in contact with. I think we need a whole other public health push to cooperate with contact tracers. But that being said, before we let you go, I just want to ask you more about some of the CDC recommendations that have been changing in regards to isolating once you've tested positive. What do we know about that?
Yeah, so the CDC prior to now was essentially saying that people should have 2 negative nasal swab tests before they come out of isolation. Well, we see that that's pretty much impossible, since tests are not really efficient right now. You can't get them, or there's a high turnaround time. So now the CDC is saying, based on pretty decent research, that people should be in isolation for 10 days or after 24 hours after a fever is broken. And what we've seen, actually, a paper in Nature has reported that around day 5 of an infection, those neutralizing antibodies kick in. And by day 8 or 9, there's no longer any live virus detected. So, and contact tracing studies have also pointed to the fact that people are most highly infectious within 5 days of infection. So this really speaks to, good medical evidence that 10 days of isolation is likely to be enough if you have a positive test and symptoms. Now, that's distinct from self-quarantine or quarantine, where you may have been exposed to somebody, you don't have symptoms. They're recommending 14 days of quarantine in the event that that happens. So it's another way that we should be thinking about isolation in the face of a positive test and symptoms.
All good stuff, Dr. Neeta Ogden. Thank you so much. Always a pleasure talking to you.
Thank you so much for having me.